I'd like to open it up to questions. So if you have a question, raise your hand and somebody will come around.
So if this has already been covered, I apologize. But the model that the administration is proposing to provide financial incentives for physicians to adopt EMRs, it has been used successfully elsewhere. There's really nothing new here. Australia, New Zealand, and the Netherlands have virtually universal use of electronic medical records by physicians, so it can be done, and I don't think their physicians are any smarter than ours. What will be interesting to see is how well it works in our uniquely dysfunctional system, and they do have the advantage. They do have the advantage of having a system that's far more logical than ours. But I would ask the panel to comment on one thing. I mean, to me at least, and I'm a physician and I teach health IT here at Georgia Tech, so this is a subject I'm kind of interested in. To me at least, the answer to a lot of your questions is obvious, although not easy. We have an incredibly wasteful healthcare system. And the answer to many of these questions of how providers and hospitals and physicians are going to survive and the country is going to survive is we have to develop a system that's not so wasteful. We have to develop a system where physicians don't send patients whose knees they've never examined to get MRIs. I know what of I speak. That is a daily occurrence in this country. The problem, of course, which many people have pointed out, is that one person's waste is another person's revenue. How do you see us getting through that in this uniquely dysfunctional environment?
Whenever a professor speaks up, you always think, oh my, I'm stepping into a trap here. You brought up the topic of how health systems work in other countries. We spend a lot of time looking at that as well. We operate the health system for the entire country of Denmark, and the error rate in that country, you have every citizen has an online medical record. All of the physicians have access to it. You can go online, schedule appointments. The information's available to the physicians who are caring for you. It's secure. You protect their privacy. People have access on a need-to-know basis. The error rate in the country of Denmark is in the lowest of the world. As we've deployed this, the satisfaction of the citizens has gone up. They have the highest satisfaction in the health system among countries in Europe. So there's really some powerful examples of what can be done. In the United States, there are powerful examples. There are 5 states whose health systems are on productivity and cost effectiveness levels that are at or better than the average of the European countries that we often say have better systems. So the examples of it working are existing here in our country. And so I think what this, the problem that you pointed to in terms of one person's expense is another person's revenue, until we can really share the information, have the opportunities to analyze it, it's very difficult to address those inefficiencies and manage to them. And so I think just a step in the direction of greater transparency, which is something that the policies are set up to provide, is an important step in that direction.
While that mic's getting there, we've also discovered that there's 10%, just pure 100% fraud in the system. And those are dollars that aren't going to cover MRIs. Those are dollars that are just absolutely wasteful. If we develop smart systems that bureaucrats can't chase paper fast enough to find the fraud. So if we develop smart systems, intuitive systems that say a doctor or a dentist can't do 976 procedures in a day, but we only find that 3 years later when we start retrospective examination of where we spent our money. We just spent $1 billion in the state of New York chasing pure 100% fraud. It's amazing.
Good morning. Following on all of your comments that change is slow in this industry, I have a question from many of us in the room who are seeking new opportunities, and that is, how do you foresee those of us who come from other industries applying our innovative skills to the best opportunities? Is it EMR, clinical analytics, revenue management? What area will those of us who want to take our skills into this industry want to point ourselves to?
I can talk just from my experiences in this, watching what's going on, but where you are in your skill set in terms of doing that, the change management issue is huge. So if you have any kind of workflow, work, even team building, consensus, all those skill sets are incredibly important in healthcare. It is a team environment. It's built that way. I mean, I was 10 years in a hospital before I moved into the other, aspects of health IT. And what you find are folks who need help coming together, figuring out a course of action. If you know the QI cycle, the Deming cycle, the PDSA cycle, those are things that are helpful. And those are not just health IT things. I mean, that Six Sigma is used throughout the industry. It's those kind of skill sets that are going to be incredibly important. When we look at EMDs internally about how we would meet that. If every physician, the 500,000 or even the 50,000 they're trying to do in this short time period, came knocking on our door, we don't have the bandwidth. And many other, vendors in EHRA say the same thing. We could not handle that flood. And some of the monies in the grants are to get folks educated. There's some focusing on programs that can do it in 6 months because they are expecting that kind of flood. And I want to just talk about some of the cost issues and the duplication of tests. I don't know if you all probably don't. I just geek out on these things. The CBO report, if you look at it for this part of the Act, it's really $30 billion that's being invested. And the net to 19 is because they expect $20 billion in savings. That's in the duplication of tests. That is in the quality improvements of adverse drug events. It's in reduced hospitalizations that aren't required. So there's a knowledge that we're going to put money into it, but we're also going to improve outcomes. So they're going to need folks who can do things like, what do you do to do your workflow? What do I need to do to get my patients and see them better? AAFP, which is the Family Practice Society, they have a program called TransferMed, and what they're trying to do is go out and focus on a concept called patient-centered medical home. It's very, very hot with the government right now because it focuses on patient choice, what they want to do, what you want to do for the patient, and it's taking a team approach. There are tons and tons and tons of these small practices that don't even know where to start. I mean, when I was at ACP, we did a study on 36 small practices and found out that they could not even figure out how to do very basic things like get a workflow going. So that's kind of where I see the skill sets being in need.
On the jobs question, there was a administration official in the past couple of weeks that said explicitly, healthcare will lead the way in job creations as a result of this stimulus and rebuilding effort. Speak to that, well, let me tell you, he was coming from the point of there is less, although there's plenty of outsourcing to Asia and elsewhere in healthcare, but there's an idea that there's less because of the uniqueness of healthcare as an industry. But speak to that. Is healthcare really going, or is the stimulus really going to create jobs leading the way with healthcare?
I probably get 3 to 4 calls a week from headhunters specifically for implementation, project management type people. Last time I checked at Monster, not that I'm looking, Mark, or anything, but what we do for vendors don't know this, but we'll look and see what vendors are hiring. If they're looking for a bunch of .NET programmers and they don't have a .NET solution, what do you think's going on there? They're about to sunset a product or come out with something new. So we use the job posting sites to gather a lot of intelligence on vendors. But having said that, the last time I checked, there were over 300 openings for EMR implementation specialists with the average base pay between 70 to 100,000. Now, it's grueling work. It's on the road. But that is an area that virtually every single vendor that I know of calls me. I can tell you that there are some vendors that are backlogged, that have sold systems that they're yet to install. And, so that's going to be a real challenge. And I do see that's going to be one particular area is in the actual project management, the implementation. And a lot of you folks here today do augment that by providing technical services. You supply hardware, your security auditors, your financial people. I see Todd with ACI that does leases. He's ready to finance any one of your clients that you guys have. So there's a lot of sub industries that are going to feed off of the decision to move forward with IT.
Is the stimulus, or what is the stimulus going to do to make sure that they don't go to Asia, these vendors don't go to Asia to get those .NET programmers or the work that they can do, and some mechanism to keep those here as opposed to going out and get 70% reduction in the costs?
Well, I don't want to get too political, but I think our administration right now is a little bit anti-prosperity and a little bit hard on corporations that want to make profits in the taxes. So I think if that continues to happen, then corporations, and some already have, will look to other countries to provide that labor. That's just what they're going to do to keep their margins. I mean, we want to create jobs here in the United States, but if we're going to continue to make tax those profits, people will look at that. So
I'm going to go.
There's nothing in the stimulus package on it.
I'm sorry. Go ahead. I'm sorry. Go ahead.
Oh, well, I was going to say there's nothing per se in the stimulus on that at all. It's certainly the one thing I think is, these privacy provisions that have been added. There was a lot when HIPAA first came out about overseas, that you couldn't enforce it overseas, and like transcription services in particular. I remember there were a lot of issues going on. They're still studying and have promised perhaps to add more of those, so it may come de facto through the privacy piece of it that they'll say it has to be domestic, but that's not anything in the package that I've seen. It's certainly, D.C. has openings for government.